Hi, my name is Mandy Whitt. I'm a physician here at Neuroscience Institute Headache Center, and I am going to be talking to you about predicting your migraine at the Norton Expo 2021. So let's get started. So today I'm going to be talking about what is migraine, what causes migraine, what are some of the triggers and symptoms, and what can be done to treat your migraine early. So the first thing to do if you're trying to predict your migraine is know, do I have migraine? So let's talk about what is migraine. So for the diagnosis, there is no one single feature that's required for migraine. So what we kind of go by is these are actually the diagnostic criteria. So you need two of these four. So you need a unilateral or one-sided throbbing, moderate to severe, or worsened by exertion. So, but you notice here, 40% of patients have both sides of their head hurts, and 50% it doesn't throb. And then only like around 20% of patients only have mild headache. So you only need two of these. And then the associated symptoms here, you need one of these two right here. So you need nausea or vomiting, and then light and sound sensitivity. So that's what the phonophobia and photophobia is. So it's also know that this is really common. You are not alone if you have migraine. There's over 47 million Americans with this. It's over 50% of disability from neurological diseases. Like that's 15% of the US population that has migraine. And a lot of people come to me and go, well, I didn't have headaches when I was little. It just started right around the age of 30. You notice that around 24% of women have headaches that start around, or migraine that start around the age of 30. So that is not uncommon. So you can start as early as when you're a young kid, but it can start at any time here. So what do I hear a lot though? But no, I just have sinus headaches. And so this is where it's going, well, do you have sinus headaches or do you have migraines? When a lot of people think, no, I have a lot of congestion here, I have a lot of drainage. We actually did a study. I personally didn't do the study. Dr. Dodick and them did. But they did, and with the self-reporting symptoms, when they reported all of those criteria, over 86% of those patients truly had migraine. So, and then there was another study done back in 2013, and because of this sinus headaches, it can take up to 1 to 38 years for them to get proper treatment. That's almost 70% of patients then got improvement of their sinus headaches once they truly got diagnosed with migraine. So that's why it's important to know if it's migraine. This is how many patients were misdiagnosed in the 80s and the 90s. That's a lot. So a lot of people go, well, why am I getting them? So we now know how to diagnose. Like, what's the diagnosis? But why? What's the cause? So back a while ago, we used to think, oh, there's a vascular theory where blood vessels can dilate and that causes pain, followed by, constricting, causing aura, dilating, causing pain. It doesn't explain all the prodrome. I'm not supported by blood vessel studies. Other meds aren't effective. So it's just not right. We now think of the neurovascular theory, where referred pain from the dura and blood vessels causes some of the pain. So just briefly, I'm going to go over that with you. So basically, think of your brain as a more sensitive brain, okay? Not saying people are more sensitive, but your brain is more sensitive, okay? So your receptors can release these neuropeptides like substance P, CGRP, neurokinin A, and these all get released right here, right? And so they can get increased from these ganglia and cause the pain. And we've actually seen where infusions of these can actually trigger migraine and headaches. So after that happens, it can lead to vasodilation, and the thalamus, brainstem, all these get activated, which leads to central sensitization and allodynia. So then what's some of the triggers that can happen? Okay. So, because you're going, well, that's all great and good that that's some of the chemistry, which I did gloss over. So some of the triggers can be stress, menstruation, changes in sleep, skipping meals, changes in weather, and your diet. And some of these can be hard to predict because it can be up to 72 hours before you actually get the pain. Now, with stress, like some of the things you can do is eating regularly, maintaining a healthy weight, quitting smoking, exercising gently but regularly. Like when I tell people about exercise, they're going, oh, if I exercise too much, it's going to give me a horrible headache. And I'm like, yes, I am not talking about going out and running 3 miles. I am talking about yoga, Tai Chi, things like that can help. Practice relaxation, get enough sleep, but not too much, and physical therapy along with acupuncture. Now, your period. So a lot of women go, well, it's only when I get my period that I get a headache. I'm like, absolutely. And they look at me going, well, I thought I was being silly. And I'm like, you're not. So we know that sometimes in the estrogen levels, right before your period, your estrogen levels can drop. And so migraine is thought to occur due to the rapid change in your estrogen levels. So we've seen during pregnancy, a lot of women's migraine can improve during that. And actually 60% of women with migraine tend to report menses as a trigger. Now, that is not saying, oh, everyone go out and get a hysterectomy, go out and get on birth control. There was a study going, a third of women get better, a third of women stay the same, and a third of women can get worse because of those hormone changes. So do not go out and change everything based on this. We tend not to do that. It's just one of those potential triggers for you. And then diet. So everyone's going, oh, it's always diet. And I go, yeah, so diets and what you eat can play a role in it. However, there's also been studies going, some of the specific foods we found can cause it. Well, we've compared the foods high in the quote unquote high migraine type foods and low migraine induced foods. And both groups got better. So what that kind of showed us is it's more the schedule. So it's eating regular meals. So it's not one specific food that generally causes the issues. It's more the habit. So if you have a high sugar, low sugar, things like that, that can tend to cause more headache. So I like this one for the triggers because it's your brain sensitive, right? So your threshold is here, and it's as those triggers build. So you have lack of sleep, you have you're on your period and then you ate something weird. And once you hit that trigger, bam, you have the headache. You got that release of those neuropeptides, and that happened. And so when you can watch what your triggers are, it can help. So some of the other things is prodromes. So we talked about the predictable chiming around menstruation and ovulation. Some of the other features can be prodromes. So when I'm talking about prodromes, it's that few days beforehand. Some people will get moody, and it's not just always cranky and upset. Some people get really happy. You can be very excited and lots of energy, and then you kind of get that crash. We talked about the classical triggers, and then sleep. So sometimes sleep will help migraine. So if you notice you've got sleep. And then family history. So if people come and tell me, oh, yeah, my mom has it, my dad has it, my sisters have it, my brothers have it, I'm going, you probably have migraine. And then if you have a history of a lot of stomach issues when you were little, motion sickness, things like that, yeah, those are generally precursors to you probably going to have migraine when you're older. So, and then smells. A lot of people will be very sensitive to certain smells. So what's another thing? You're going, well, that's all good, but I get these weird vision stuff. I go, aura. So I like to show people pictures like this and go, any of these look familiar? And they go, yeah, this one's mine, or this one's mine. Or they go, lasting about 20 to 30 minutes. So what this truly is it's not just some funky thing and you're going crazy. It is truly a reversible focal neurological deficit. And we don't think it's because the blood vessels are dilating anymore. We think of it as a cortical spreading depression, which is a wave of activity moving across the brain, followed by decreased activity. So, and it normally starts in the occipital lobe, which is what causes your vision. So on EEG, we've actually mapped out this, and it's unfortunately, or fortunately, I think it's pretty neat. It just is not always fun when you see it. But if you see an aura, you can pretty much tell you're probably going to get some pain following. So some more causes can be medication overuse headache. So when you have migraine, a lot of times people will start taking more and more NSAIDs because they go, oh, well, this helps. So one of the biggest questions I always ask people is how much medicine are you taking? Because what you can do is you can sensitize those receptors. And so if you have a headache present for more than 15 days with taking over-the-counter use of medicines or other medicines for more than 3 months of one or more drugs that can be taken acute or symptomatic, and your headaches start getting worse, and then your headache gets better after discontinuation, you've probably got one of these. And so some of the medicines that can do this are butabitol, which is opioids, triptans, NSAIDs, and you can see how little or how quickly you can get into medication overuse. So you can almost know that as soon as the NSAID wears off, you're gonna get another headache. And it only takes 2 days a week or 10 days a month for an NSAID or Tylenol. And so these are some of the common ones that can do it. Like the combination products, Fioricet is really a little more than 1 day a week. So if you are finding that you're getting more and more, needing it more and more, this is potentially the cause. And that's one of the reasons why most headache specialists don't use many opioids or Furosemide because it can lead to more headaches, and then opioids can then lead to more headache disability, more depression, more anxiety, and more cardiovascular events. So we just don't use a whole lot of them. So other symptoms with headache or with migraine can be nausea. So if you get a lot of gastroparesis or a lot of nausea, it doesn't allow some of your medicines to work very well, but it also can be going, this is not going to be a good day. Other symptoms that are not as common as the previous ones that I talked about can be blurred vision, neck pain, nasal congestion, sweating, dizziness. This is a reason why a lot of people are going, is this migraine or is this a sinus headache? So this is some of the ones that I see a lot confusing sinus headaches. Is it coming from my neck because of neck pain? But as you can see, 31% of migraineurs have neck pain with it. So what I encourage most people to do if they're kind of trying to figure out what they can do is do a headache diary. So find your tracking tool. There is not one that's better than another, but I encourage everyone to try one. So there's online headache diaries. There's tons of them out there. And I say, which one's the easiest for you to do? Okay. So I like finding triggers and tracking all that, but if you're in a lot of pain and you go, I can't remember, it's awful, I can't do it, don't. If you go, no, I need to write this stuff down, I need to do it, do. And that I find is the easiest. Find one that you can do. That is my best advice. Some people like printing them out. Some people like them on their phones. And then keep track. See how often and if you find any commonalities, foods, menses, time of the day, things like that. So why would it be nice to predict your migraines? Because if you can prevent your triggers, it can help. If you know that, oh, I am not eating right, you can kind of go with, oh, if I've skipped meals, try and eat more regularly. If you're going, it's always the weather, it's always this, you might want to go on more prevention medications. If you go, nope, I'm taking too many rescue medicines, I'm taking them every day, you might want to slow down on them and go more to preventions. So it can help. So in summary, migraine, hyperexcitable brain that some people can predict, not everyone. Try and keep track of your triggers, keep track of your aura if you have it. And then knowing this can potentially help with your treatment and when to treat. So thank you. Have a good day.